Councillor Bissinger is not going to make it. She's not well today, so she will passes her regrets. First item is adoption of the agenda.
Second.
Okay, all in favor? All right, and we also give notice that the public hearing has been scheduled for 6:30 this evening in these council chambers in order to consider the following rezoning application RZ 19-6, and that's the groundwater bottling. And so the first item we have is delegation. John and Jennifer Hedekan, please come up to the podium. Yeah.
That thing
That thing there.
Hello, and thank you for this opportunity to speak to you today. My name is John Hedekan.
And my name is Jennifer Hedekan. We are hopeful that by presenting this information to municipal council members of the Comox Valley, it will bring change to how councils are responding to this toxic drug crisis by holding our provincial and federal parties accountable for the staggering loss of lives in our communities. The current federal drug policy that supports the war on drugs is an absolute failure, and it has no positive change in our communities and never will. We are hopeful that councils can address these issues, as provincial and federal party politics do not influence your work and your advocacy, and that we hope that councils will be able to pressure provincial and federal leaders and parties to then change their policies. Our family lost our son and a brother on April 24th, 2017 to fentanyl poisoning. Ryan was a healthy 26-year-old at that time of his death. He was one of 124 people in BC to lose his life that April. And 2.5 years later, we still have over 100 British Columbians continue to be poisoned and die what we consider preventable death, month after month and year after year. Ryan had just completed 8 months of recovery at a private facility in New West and had gone back to work as a third-year electrician when he relapsed and died through fentanyl poisoning on his job site during his lunch break. Ryan lost his life. He so badly wanted to live, and our family has had our lives changed for the rest of our lives. There are no words to describe the pain and sorrow every day of not having Ryan in our lives. Dates on the calendar that are times to gather and celebrate getting together are now dates that we grieve, as we are a family of 4 and not of 5. I've said many times that we wish Ryan would have been addicted to alcohol, because a safe source of alcohol is provided through a government-controlled system. And Ryan could have purchased what he needed that day, and he would have had the opportunity to try again. Our current drug policy, which allows organized crime to be the sole provider of toxic drugs, has killed over 4,000 people in our province and over 13,000 in our country, along with putting millions at risk of immediate death. And it's our drug policy that's responsible for his death. The toxic drugs supplied by organized crime does not give substance users another chance.
There's so much more to say that would describe who Ryan was and what he wanted in life. How much he meant to our family, how much he loved his family and life, and how he fought a disease full of stigma and shame. The disease of addiction affects more people than cancer. There's 8 million in Canada. Yet it is treated so differently. We wouldn't allow organized crime to fill the prescription for any other disease or allow them to be the sole provider of any other product in our communities. Our family experienced the appalling lack of support there is in our community and communities across our province and country when seeking help for addiction. When Ryan called us asking for help, our community and health system left it up to us to get him that help. Detox was not available in our community, and I had to drive around the Comox Valley for 2 days buying Ryan heroin, not knowing if it would kill him. Recovery facilities do not offer intake on weekends, and it was a Friday when Ryan called us. 2.5 years later, I called the Comox Valley Recovery Center this last Saturday to see if detox was available, and I was told to call back on Monday to make an appointment to discuss detox. Ryan was sent away from our emergency ward with my wife as he was handed a card that said to call the addiction nurse on a Monday when an appointment could be made within 2 to 3 weeks to see her. And then to see the one addiction doctor in Campbell River in a few months. If you're in excruciating pain due to withdrawal and you ask for help and you're told to call on a Monday to make an appointment, how well do you think that works? If you have chest pains, you are not told to call on a Monday to make an appointment. And subsidized recovery in the Comox Valley, if a bed is available, is $150 per day. And it cost our family $13,000 a month at Edgewood in Nanaimo and $8,000 per month at the last store in New Westminster, both private facilities. At both private and subsidized facilities, the patients are offered a 12-step program and told not to use. This 12-step program was introduced 85 years ago through Alcoholics Anonymous. We don't offer cancer patients the same treatment we did 85 years ago, and they aren't told to just stop having cancer. We were told at Edgewood that 92% of the people who enter will relapse, which was so hard to hear, but you have no other options. Relapse is a normal component with the disease of addiction, which is a complex neurological disease that needs to be updated and research treatment methods used to treat it.
When we took Ryan to Edgewood, I thought all he had to do was detox, and then life would be back to normal. I didn't realize that it was a reoccurring disease, and that
You're never cured.
you cannot use, but you're still always an addict. Our BC Coroner Service has recently changed the language they've used to report deaths due to the current opiate crisis. Illicit drug deaths are now reported as due to toxicity, not overdose. Substance users are not dying because they have taken too much. They are being poisoned to death through a toxic supply. We have always said our son was poisoned. He did not overdose. And this new language by the BC coroners takes the onus off the individual and puts it on the elected officials that are responsible for the safety of all members in our community. If any other demographic was being poisoned by any other product, the source would be named. Yet the source, organized crime, and a toxic drug supply has not been addressed. It hasn't even been talked about. If you think of our latest federal election, it didn't even get mentioned. So every month, for close to 4 years, a loved family member of the Comox Valley has died a preventable death. Starting in 2016, we've lost 55 Comox Valley residents due to poisoning by a toxic drug supply. And those 55 lives do not represent the family like ours that have had a family member die outside of our community. So that loss of 55 loved ones is actually much larger for the Comox Valley. And if it wasn't for harm reduction services, our health professionals estimate this number would be 2 to 3 times higher. Instead of over 4,000 in our province, the appalling number would be approximately 12,000 deaths. That number would be equivalent to about 90% of the residents living in the town of Comox have their lives taken due to a toxic supply, if not for harm reduction. Elected officials must represent all members in their communities and speak for their safety when lives are at risk. Elected officials will defer to speaking about harm reduction in addressing this crisis. And while these services are so badly needed, they have not made a dent in the amount of deaths. The harm reduction services target the chronic user, and they do not address the first-time or the adolescent users, the millions of recreational users, the many users affected through our medical system, or users like our son who relapsed after recovery. The vast majority of substance users are never going to a safe source consumption site or will not seek prescription heroin.
How would the many functioning alcoholics in our community and communities across our country that hold jobs, have relationships, contribute positively to our communities, make out if they didn't have easy access to a safe source? If they had to live in stigma, source what their body demands from the alley, and consume a toxic drink that organized crime sold you with no regard for your life? Our son Ryan would die again 2.5 years later if he was coming out of recovery. As our elected officials that are responsible for the safety of citizens have not addressed the toxic supply. Since 2016, the Comox Valley has lost the 55 loved family members to this toxic drug crisis. If your fellow council members were dying to any toxic source at the rate of 1 a month since 2016, would this city council have the same response if your co-workers are being poisoned month after month as you had for the toxic drug supply in our community that has killed Comox Valley residents of all ages and walks of life? Our province has lost over 4,000 lives since 2016. How would our provincial parties respond if all 87 MLAs plus 30 support staff died month after month? And our country has lost over 13,000 lives. And how would our federal parties respond if all 338 MPs plus 30 support staff died every month since 2016 to any toxic source? What would the response be if these toxic drugs were killing nurses, teachers, first responders? We saw our country's response when 16 young hockey players tragically lost their lives in Humboldt, Saskatchewan. And we're a hockey family. All of our kids play hockey, and it was tragic. We saw our country's response when 16 hockey players we would not allow a hockey bus to keep crashing at that intersection, killing innocent lives. But we allowed a bus in BC that crashes each week with a loss of 25 innocent lives, and that bus has been crashing each week for 4 years. And a bus also crashes each week in all provinces. Elected officials will agree with our science community and say we must follow the evidence and make change in the climate crisis that we face to save lives in the future. Unfortunately, these same officials will not hear what our health professionals are telling them when they state we must address the toxic drug supply to stop people from dying now. This toxic supply must be replaced with a safe, regulated supply. And the stigma associated with addiction and substance users can never be removed and will always prevent people from openly seeking help if the word criminal is attached. You can tell your neighbor or coworker you have a family member bravely fighting cancer, but stigma and judgment will prevent you from saying, "My son's addicted to heroin." And is bravely fighting addiction. Ryan was no more a criminal for smoking heroin than his brother and sister were for drinking alcohol. Our obsolete drug policy made him criminal.
Portugal has shown that decriminalizing personal possession of drugs has drastically improved the lives of drug users and their whole community. In Portugal, a user is not a criminal, but rather a human being that possibly needs support. And if they need support, it's available. We have decades of evidence that the war on drugs has been a complete failure in so many ways. Organized crime generates billions of dollars of revenue from drugs annually because it is used by billions of people in all walks of life. The war on drugs is a war on ourselves, and it will never be won. And this is evident around the world. Think of those wasted billions of tax dollars decade after decade that has no positive effect in our communities. The prohibition of alcohol was not realistic, and neither is the prohibition of drugs. So we're here tonight asking the Town of Comox Council to change how you respond to this crisis. And that is, sadly, month after month, seeing people poisoned in our community. Your council has the opportunity, along with the Village of Cumberland and the City of Courtenay, to start what other councils need to do. Stand united and reach out to all media to demand that all provincial and federal parties address the source, organized crime, and their toxic drug supply. The government needs to be the sole provider of all drugs, which will stop people from dying preventable deaths in our community, to finally remove drug houses in our residential neighborhoods. My doctor told me that there are 43 known drug houses in our in Courtenay. I'm a school teacher. My children, my students, they live in those houses. They live beside those houses. Let's take them out of there. Let's finally remove drug houses from our residential neighborhoods, and to spend that tax dollars on issues that will make positive changes. We ask you to call on other municipal councils in our province and across the country to follow your example, to be a real voice for change and speak for those that need you, to represent them and their safety. Our provincial and federal elected officials are not being held accountable for the people in our community and across the country that are dying a preventable death because of their current drug policy.
Drugs and alcohol are part of life, always have and always will be. We've normalized the alcohol user, and we've criminalized and judged the drug user. We have two choices only. Organized crime can control substances, or our government can through a system like we have for alcohol and marijuana. Which one will save lives, remove stigma, stop wasting billions of tax dollars, remove drug houses from our residential neighborhoods, make real change eliminating gun and gang violence, collect billions in revenue currently collected by organized crime, along with providing a tax base and jobs like we do with the vast alcohol and marijuana industry? Thank you for this opportunity to speak to you. We are hopeful to hear, see, and read your response that will address the continuing preventable innocent deaths in our Comox Valley. Thank you.
Well, John and Jennifer, thank you very much. It was very moving what you have to say, and our condolences to you and your family. Does council have any questions, comments? Councilor McGowan?
I know reaching out to the province and the federal government is one of the biggest things that we need to do. But is there anything that we can do municipally to help fight the stigma that is rampant?
To me, if the Courtenay, like we asked, if the Courtenay Comox and Cumberland Council were on TV saying the response from our federal and provincial governments is not acceptable for the deaths that are happening every month in our community, and it's a toxic drug supply. They won't even talk about it, the toxic drug supply, because it's a toxic subject, and it's the perceived loss of votes prevents them from saying what needs to be said, and they will only speak to party policy, rhetoric. So our thoughts were, council is not tied to party policy. No one's telling you what you can say and what you can't say. And you're an elected official, and I think that you have to call our provincial and federal governments out on their lack of allowing people to die. It's not like we have to figure out a cure. We know why they're dying. And we're wasting tax dollars. We could just repeat ourselves all night. It makes no change in our communities, and we know the issues that our communities have that would make real change if we spent those tax dollars on other things other than RCMP that makes no change. I don't know if that answered your question.
I would say put time and energy into recovery, to treatment, to those are political, those are provincial systems, right? There needs to be more social workers on the ground, there needs to be more educated healthcare professionals, there needs to be, all of those resources need to be
And we would have it if we didn't fund the war on drugs. The closest thing to free recovery in the Comox Valley is $4,500 a month. Who has $4,500 or $8,000 or $13,000?
with 92% chance of relapse. Thank you very much.
Any further questions? Councillor Grant?
Just one, John, we have conventions that we go to that are either island-wide or provincial-wide or even federal-wide for that matter. And we can bring resolutions through those to put pressure on the province and the federal government. So I'd be happy to sit down with you and maybe Councillor McGowan or whoever else wants to and draft a resolution that you think would be good. If we get that passed through council, we can take it to that level and see if we can make some change that way. So I'd be happy to do that with you.
Thank you.
Very good. Any other questions? Seeing none, again, thank you very much for telling us your story.
Thanks very much.
All right. All right, moving on. So we have for approval the minutes of the regular meeting, council meeting from Wednesday, November 6th.
Move.
Second.
Any questions? All in favor? Okay, approved. Public hearing meeting minutes from February the 6th for approval.
Move.
Second.
Any questions? All in favor? Okay. And the minutes from the public hearing Wednesday, November 6th for approval.
Move.
Second.
Questions? All in favor? Okay. Committee of the whole meeting minutes for receipt from November 13th.
Move.
Second.
Questions? All in favor? Okay. Special council meeting minutes from November 13th for approval.
Move.
Second.
All right, questions? Okay, all in favor? And no committee reports. The management report for November 20th received.
Move receipt.
Second.
And any questions, Maureen? That's just ongoing, I gotta say that.
Dear.
Yeah.
Well, I do actually have a question,
Yeah.
but I think it was addressed in the email, but since I had trouble with my tablet, I haven't been able to follow it up. Anyway, my question is around the electric charging stations.
Right.
And I posed a question earlier because I know it's not directly related to the management report, but it's in addition to, and I posed a question to our planner and CAO, and I'm wondering if we've got any more information.
Yeah. Well, we do have it in the management report.
But that's a grant.
Yeah, okay, that's the thing, yeah.
This was the one that was attached to the Balmoral development?
Right.
Yeah.
Marvin will comment.
Marvin?
Yes, so the funds taken as a net entry from the Balmoral development, $25,000, were allocated for electric vehicle charging stations or improvements to the Hampton Park. We have confirmed there are no improvements in Hampton Park being proposed at this time. The Shelley Trust Fund is following up with the regional district on the larger EV charging station program as to what the status of that is. Shelley Ashfield has had conversations with the mall in terms of there is a grant program for private property owners to provide charging stations, and we'll be following up with Mr. Coon in terms of if we can work together in terms of providing charging stations on the wall. She's also looking at other sites throughout the downtown and grant opportunities to see if we can leverage the $25,000 to provide electric vehicle.
Great, thank you.
Thank you. Councillor Grant?
Yeah, so just a little further on that, I did talk to Mr. Kuhn from the mall a couple of months ago, and they were certainly open to speaking about whether they could put some charge stations in there, whether, I didn't talk about who we paid for it, I just mentioned to them that we had some money coming from the Balmoral one. So I think they'd be open to that discussion. But my question was regarding the boundary extension on Torrance Road that was to the ministry. Is there any new news on that, or what are we saying?
Back to Marvin?
No, that's
Shelley? Oh, okay.
So at this point, what we are proposing doing is just writing a letter to the minister to request if there is any interest in partnering or grant funding any opportunities to help with the rebuilding or bringing the Lazo Road portion up to a higher level standard.
I had a inquiry from some realtors wondering about what was going on with that. So, fair enough, thanks.
Councilor Minions?
Just a quick question regarding the plastics bylaw on meeting with the city of Courtenay. Has that meeting taken place, or is it in the future to talk about what their plans are for the voluntary?
Yeah, we haven't heard back from the city, so there's nothing actually planned at this time.
Just a quick ED note. I found out there's 2 at the full French school, and apparently they're open to the public during the day, but I'm sure to put it on any Comox map, that probably won't happen, but there actually is 2 that are open to teachers and schools, community stuff. It's interesting hearing where there actually are some already that, when people say there are 0, there's actually 3 known plus plans.
All right.
Thank you.
Any further questions?
Just more of a comment. It's wonderful to see that there's action being taken on the heritage rates.
just recent.
Just research.
Yeah.
Just something has changed, and that's just really nice to see. So,
All right. All right. Seeing no more, all in favor of that? All right. Then we move on to special reports, the regional district meeting minutes from October 29th for receipt.
I'm going to receive those November 5th and November 7th.
Okay.
Second.
Any questions? All in favor? Thank you. Bylaws, we have the, this is the record management system bylaw number 1932, 2019, for adoption.
Move adoption.
Second.
And any questions, staff, on this? I think it's a good move forward to keep things cleaned up. So all in favor? Okay, carried. And moving along now, so new business, no motion. So we have recommendation from the CAO for the electronic participation in council meetings. This is procedural bylaw 1964-2009, amended number 2019, be given first, second, and third readings.
Move that.
Second.
Okay, any questions about this? Councillor Minions?
In concept, I think it's great. And just how would we be able to ensure that the person who's calling in or videoing in is also going to show up on the video? Or is that something we have the technology now for? Or is it something we'll
I
invest
think
in?
you just kind of left it broad, right, like electronic, so...
Yeah, so it allows for both voice-only participation through one of those conference
System.
call phones, or we are working with IT and Clive in trying to get a video link up as well.
So that would this would incorporate both?
It would incorporate both, that's right.
Perfect.
And Councillor Grant?
Well, it's just, just further on that, I've been at the regional district where this actually happens, and it works okay, but it's far from perfect. But one of the issues is that sometimes they don't get to see any presentations that are coming.
Mm-hmm.
So is there a way to make sure that they would get a copy of the presentation, just so they're on the same page, right? Otherwise, they're,
Yeah,
Yeah.
I have a question around that. Oh, sorry.
Yep, go ahead.
I have a question around the disconnection if the call drops. And I think it's 10 minutes in there. 10 minutes is too long.
Yeah.
I think it should be shorter. Like, I don't see any reason why somebody can't redial within 5 minutes. And because you're not going to get there anyway. So to
Yeah,
stop
you're not gonna
proceedings
get
for
it.
10 minutes
Yeah.
would probably be a hindrance. And I expect calls to drop because it happens in the real world.
That's what happens from time to time.
Yeah.
Well, we could make that amendment, could we?
Yes.
Need a motion for that, or just?
I would need a motion for that, yeah, that
Okay.
the procedure bylaw number 1614, 2000, amendment number,
Yeah.
there's an amendment I'm missing.
Do we want to go around the table first, because there might be other suggestions for
Okay.
amendments? And then,
Sure.
because I had something I want to think about. Ken, did you have something?
No,
else?
I'm
Okay.
good with it.
Pat, you're good with that?
Yeah.
And any other questions?
I don't know if it's necessary, and I don't believe I saw it in there, but do we want to put like a maximum number that a council member can?
I think it's in there.
It is in there?
Yeah.
Sorry,
Yeah.
it's missed it.
It's 2.
Perfect.
Yeah.
They're allowed 2 a year?
Oh, no,
Yeah.
sorry.
Good.
No,
I
it
thought
was
it
in a
was
row. It was
unlimited.
more in a row.
Oh, I thought you meant
Members
members attending through electronic.
I did.
Okay, so 2. We can have
Yes.
2.
I thought at one meeting, 2 people go. That was
Okay, go ahead.
Yeah.
Shelley?
It is 2, limited to 2 at any given meeting, as long as there is a majority of members attending in person. So-
I was talking about
Yeah, so your question
consecutive,
was
so
different.
what I was curious if all of a sudden a council member decided to, not that anybody would,
Live in
But
Hawaii and.
come like do 10 in a row or something, would
Yeah.
it be prudent to have like a maximum of 3 or 4?
And that was my question I was going to have,
I
because
just-
there was that senator in Ottawa who was living down south, and he was missing all these meetings, and so, yeah, we don't have that in there, I believe, reading through, we don't have a limit. You could,
We don't have a
Right.
limit. What is written in there, and perhaps it's not strong enough for council's liking, is that the electronic participation is permitted for medical reasons, for travel outside of the municipality, or upon approval by council. So if you're not ill or have a valid medical reason, and if you're not outside of the municipal boundary, then you need permission of council.
Okay, that was going to be my question, so I think you answered it, because I know of a case where they had a lot of contentious issues going on, and they started doing video meetings so that they didn't have to meet, so the public couldn't actually show up, right? So that was my question, but I think you answered it, that if you actually, so we all have to
You
go
need
to
a
the
majority
community to
of
make
members
this happen.
in person
Yeah,
as well,
yeah,
yes.
but I think that covers it, I think what you said.
and I think, we do this for a year, and if we need to review it again, we have to pick up.
Okay.
Like if Alex's baby is crying in the background,
That's
we
true. I
can't
actually
hear
have
her,
that.
so. Okay, so we do have that one amendment that Councilor McKenna
I did.
had mentioned, so we'll keep it maybe to 5 minutes. Shelley, if we amend that. Pat, you're...
I'm
Yeah.
okay, is that okay?
Yeah.
5 minutes?
I think
So-
We'll amend to 10 minutes to 5 minutes for reconnection.
So you need a resolution. from
Okay, so,
council that
yeah.
I'll
that
second
the
that.
bylaw be, okay.
Second that, so any other questions on that? All in favor? All right, great, thanks. Go ahead.
And now you need to pass the resolution that the bylaw be given first, second, and third reading as amended.
Right,
I'll move
okay.
that.
Second.
All right, questions? All in favor? Great.
Thank you.
Yeah. Okay, so moving on, we have recommendation 1 and 2 here for the rezoning application RZ 19-5, and that's cannabis production.
First and second reading?
You'll move that. Any questions? Or seconder? Yes, I get a seconder. Any questions on that? Okay, all in favor? Okay, and that a public hearing in respect of bylaw 1926 be scheduled for 6:30 p.m. January 15, 2020 at council chambers.
Move.
Okay, questions? All in favor? Okay, done. All right, and we have one piece of correspondence regarding the Red Dot campaign.
I'll move receipt.
Okay, any questions on this? All in favor of receipt? Okay. We don't have any late items, delegations. I guess we'll go into reports from members of council. What do we got here? Yeah. All right, so Councillor McGowan, do you want to go ahead with your?
Of course.
Would you like me to start?
Sure, Pat, go ahead.
I'm ready.
Exactly, and then we'll go.
Give you some time.
And then we'll go to Maureen.
Yeah, sure. So, met with the Transit CBRD manager, Mike Zabarski, and the Watson and Ash general manager, Darren Richards, and Councillor Frisch. And we had a really great conversation around transit. So, been spending more and more time now on the bus and just trying to assist our citizens with the bus. And I would say thank you, Al, for the email on the bus shelters. And so I have some questions around that as well, but that's for a future date. But we talked about the bus shelters. We talked about the number 3 route quite a bit. And one of the interesting facts I found out is it's approximately $125 an hour all in to run a route for an hour in the transit system. So we were looking at that number 3 route late at night in Comox, and to do that, approximately, to take it to 10 o'clock at night would be approximately $150,000 a year. So there's a lot. It was surprisingly very, very expensive. We also talked about, and something for us to all consider, with this Courtney Bridge closure coming up, the 5th Street Bridge, they're going to be rerouting the number 1. So it's really going to impact a lot of our citizens, and I think they've not got a firm plan in place yet on how that's going to happen. So. Attended the Comox BIA AGM with Councillor Grant and Mayor Arnott. It was great. Awesome night there. Participated in a meeting with VIU students who are analyzing currently the 37-acre property that Glacier View Lodge is proposing to develop. So that was a pretty interesting meeting. Attended the 7 p.m. Remembrance Day evening vigil. Recommendation to staff is that we close that street at 7 o'clock on a dark night. On a Sunday night. Cars were going by, people standing in the street. It was very unsafe. So just a recommendation there. But it was a wonderful service at vigil, and then attended the 11 a.m. Remembrance Day ceremony, which was a really moving experience as well, and just so excellent and well done. And then also attended the Comox Fire Department Award Banquet, which was amazing. It was amazing. And to Gord and his team over there, they're just pretty solid and basic bunch.
Yeah, sure.
Yep, thank you.
Councillor Swift.
Okay, I attended the Remembrance Day ceremony as well, and I also attended the social planning meeting. That was a workshop, I guess, and they had a facilitator come in. There were probably about 20 people that attended, and what they're hoping for is a stronger connection to municipal government. And also, I think the overall impression was that it's better managed at a regional level, so that if we're all working together on something at a regional level, it's likely to be more successful. And they're likely more able to get grants if they've got everybody on board. So that was interesting, and then attended the regional district special meeting yesterday, which was in camera meeting, so more will be coming on that at another time.
Great.
All right.
There you go.
I attended the Climate Leadership Conference for 2 days. It was absolutely incredible. There were so many wonderful ideas and speakers and tangible things and future plans. It was very inspiring, and I can't wait to finish getting everything all picked up to share with everybody. The Food Policy Council met. We went over some of the CBRD sustainability strategy and what's been, what kind of movement has happened on that since 2010, and what our next steps would be. I attended the Comox Fire Rescue Banquet, which was absolutely fantastic, and we definitely they deserve to be recognized in a major way. Our community would not be the same without them. We attended a lunch on Sunday from the Ray Leonard, just to hear about things that have been going on provincially in the area. Monday was the STARA board meeting. Their AGM will be coming up soon, planning all of next year. Fun days and all the holidays and things that are coming up. And had a conference call this morning with Al and a few people from Diabetes Canada. regarding textile diversion. So that'll be, I'm sure, coming down the line eventually, but
Yeah.
very, very interesting stuff there.
Yeah, and I'd like to talk to you about the lunch with Ron or Ray Leonard and the provincial stuff after. Councillor Grant.
Well, it's always good not to go first, because you get to hear all the things you forgot to mention. I also attended the Firemen's Awards Banquet, not to be confused with Christmas party. The regional district, then it was an in-camera meeting, I think as Councillor Swift said, so more to come on that. I attended the BIA AGM with Pat and Russ, and I will be meeting tomorrow with some members of the Dawn to Dawn group, so I'll tell you more about that as we go. And I also attended the Remembrance Day celebration. That's what I did.
Okay, Councillor Mignon.
Very similar, so attended the Comox Fire Department banquet, which was great. Waste management, we had a meeting. No, you didn't. Sorry. So the site for the composting facility for Comox Valley Regional District and South Strathcona Regional District was selected as Block J in Campbell River, so that will be opening sometime in 2021 using some grant money and some CBRD collective money from the different regions. And that'll just be open to the 4 main municipalities and not rural districts at this time. So that's 2021, which has been a project that apparently has been being worked on for many, many years. So that's good that that's moving forward. The hospital board, we had a little bit of a shorter meeting, but we planned some of the things coming around strategic planning and taxes for next year and everything, because the new 2 hospitals have been open for just over 2 years now. There's no major changes expected, but just working out some of the little bugs that the 2 hospitals are having. Remembrance Day ceremony, unfortunately I didn't attend the day one, but I went to the evening one, which was really nice to see because I typically just attend the day one. And again, Pat and I noted just some things that could go a little better. It was a little dark, and yeah, but it was really nice to go to that one and do the lighting ceremony. And then I attended the social planning workshop for part of it that Maureen attended. They sent out some notes yesterday, so if anyone wants to know what some of the group ideas were. One of the ideas that I liked was it's great to have the CBRD meetings, but once or twice a year, all, I think it's 22 council members and mayor got together for kind of council of the whole, but in entirety, and invite First Nations and school districts to kind of get all of the different groups together. That would be a good idea to do. And our group talked a lot more about also connecting up with our MLAs and MPs on things we need to be advocating for. So it was basically all about, instead of talking in really small groups, trying to broaden the groups as much as we can when talking about mostly housing, food, transportation, climate change, all of that. And not in past, but tonight, Will Hamilton speaking from 7 to 9 at Comox United Church on his training under Al Gore on climate change. So I'll be heading there after. If anyone didn't know about it and wanted to hear Will talk, he's very interesting and inspiring to listen to. That's tonight.
Okay. All right, and for myself, I too attended BIA AGM. I attended the BC Ferries Forum and just talking to different community people about what could make the ferries better. Remembrance Day celebration on the Sunday. I went to the leadership lunch with Mayors Baird and Wells and Chair Jesse Kettler and the Wing Commander. We did this at 19 Wing. It was good to talk. I attended the Firefighters Banquet, which is always a good event, as Councillor McKenna said. And I did attend the Dawn to Dawn fundraiser on Sunday. And that would be it for me. Did you have your hand up for anything? No? Oh, okay. All right, so we'll go on to any public questions that we might have for tonight. Yes, go ahead, sir.
I have a question. My name is Peter Weatherly. Good evening, Council and Mr. Mayor. 6 months ago, the Council declared a climate emergency. I'd be interested in what actions have transpired.
Climate crisis, we declared at that time.
I stand corrected.
Yeah. Well, we did have a list of different things at that time. The CAO had gone to different department heads and talked about things that we had been doing. For example, the rec center, we have geothermal heat, and that's been going on for quite a while. We have solar heating for the hot water. There's a list that, that we have. I think that we could probably provide that with you, but I don't have it with me off the top of my head. Go ahead.
One of the other things that's coming up from a development and planning standpoint is an open house and a collection of ideas and information from developers, so we can move towards a higher step code in British Columbia as far as construction of new buildings and that kind of thing, right? I think the water bottling public hearing that you're going to have next is also a climate action that came from our council as well. So we've been moving several things, I think, in a positive way. We could probably move faster always, but yeah, I think those are 4 quick things that we've been doing. And if you look at our planning department, and the lens of sustainability and climate is always on all new developments that are coming through here. If you get to look at some of the proposals that are going through, and I think you'd be somewhat impressed with maybe not, but on what we're trying to accomplish.
Is there a goal?
Is there a goal?
I just want to clarify, and I totally understand where you're coming from, but these aren't really leading from tonight's agenda. And normally that's how we do it. We, items that were on the agenda, then we have the public ask us questions, and so we're kind of going off there. What I would invite you to do is contact the town hall, perhaps Shelley Russworm at 339-2202, and she could, that's 2202. She could provide the list that we had received. Shelley, would that be okay? The number of months ago, 5 months ago or so.
Having the open house sometime in the future.
Yeah, but Shelley would be more than happy to have herself or a delegate come in and speak to you on the phone about that. If you're okay with that? Sure. Okay, great.
And there is,
It's an open house.
Yeah.
There is an open house coming up on climate action.
Yeah, so again, we're getting off target there. So did I see one more question from the public with tonight's agenda? Okay, go ahead.
Actually, 2 parts. One is the presentation on the opioid crisis, and a couple of you referenced meetings with the MLAs, but you mentioned several things. The opioid crisis wasn't one of the things that was mentioned, so I'm just wondering if that is on the agenda for meeting with the MLAs.
Yeah.
And the other question has to do with electric vehicles and new development. Is there a requirement for new development to provide electric vehicle charging stations as part of their development plan?
No, but maybe Marvin, go ahead.
In general, what we've been doing is things like townhouses and getting 220-volt connections inside the garages. Some commercial developments as well. So, for example, on one new project we're looking at that's got significant surface and underground parking, it would have 220 conduit put in. We see that as a sort of major indication in terms of private or development. Running the wires is an expense, but if you have to get conduit in and through the landscaping of the buildings, it becomes cost prohibitive. So we do also have, for example, in the building right beside Town Hall, we have 2 charging stations that was part of the humanity contributions. So we've been really focusing in terms to date, in terms of getting adaptability for electric vehicle charging stations through the rezoning process, and in some cases, getting the charging stations themselves.
Okay. I'm not sure if I follow all that, so, but thank you.
Okay. Any other questions from the public? All right. Seeing none, I don't think we have any media here. So normally what I would do at this point is I would ask you all to leave because we have a in-camera agenda, but given that we have 10 minutes to the public hearing, would council just want us to